What's up, family? This is your boy Eric with Priority Mail. It's a beautiful Friday. What a way to end the work week. I'm coming to you today. I want to talk about diabetes here in America. I mentioned some information earlier this month. This is Diabetes Awareness Month. And I talked about the three most common conditions or types of diabetes. Type 1, which is insulin dependent. Type 2, which is not necessarily insulin dependent, but could require insulin at some point in time, but is most likely related to diet, lifestyle, and some genetic predisposition. Then you have gestational diabetes, which is a diabetes that women develop during pregnancy. It also places them at higher risk of developing diabetes later on in life after the birth. Now, some quick statistics. Over 84 million Americans in this country, or 1 in 3 Americans, are at risk for prediabetes, meaning that they have hyperlipidemia, high cholesterol, they're obese or overweight, and they potentially have elevated blood pressure or actually diagnosed with hypertension, which places them at high risk for developing the triad of conditions we call in metabolic syndrome, which is prediabetes. Next, over 30 million Americans have diabetes, and a lot of them don't even know it. That's 1 in 4 Americans have actually diabetes here in this country, and they don't even know it. 90%, again, are unaware, and the 10% that are aware have what I call a severe case of Deni-abetes. And that leads right into the other 3 that I mentioned in a post a while back. Talked about Deni-abetes, which again is denial, Die-obesity, which is diabetes related to obesity, and then Die-abetes, Die-abetes. You know exactly what that means. So let's dive right in with some of those 3 there. You know what the other 3 are: the type 1, type 2, and gestational. Now, the 3 that I see most often that I think are probably more deadly than the ones we really know, because it's the obvious. Deni-abetes is when you know you've been diagnosed with diabetes. You got a long family history, mom, dad, sisters, brothers, uncles, aunts, cousins, everybody got diabetes. And you've been told you got diabetes. You didn't even talk to the diabetics in the family, and when they done kind of diagnose you based on what the symptoms they have, but you're still in denial. You done gone to the doctor, you done had labs repeated 3 and 4 times, still don't believe you got it. You done had your appointment with Dr. Google or your local Googleologist. You know who it is. It's a friend or a family member that Googles everything. And you might have even, men probably have gone to the barbershop for that barbershop consultation. You know, there's always one cat in there sitting over in the corner. He done been to the doctor 11 times, and he done had every test under the sun done. So by default, he is pretty much up to speed on some of the things going on with medicine. But a lot of stuff he dropping is half truths and whole lies. You hear me? So be careful with that information you get from that barbershop medical professional. Now, even with all of that information at your disposal and all the signs and symptoms you having, you thirsty as all get up, and you ain't even ran nowhere. You ain't really done nothing to be thirsty. You are peeing like crazy, almost like you got a urinary tract infection. And then you can't eat enough, but you losing weight. Those are top 3 signs we see in diabetes: polydipsia, over thirsty, polyuria, peeing all the time, and polyphagia, being hungry all the time. Those are top 3 signs that your body's letting you know. And then you're losing weight, and you're not exercising or making any changes to lose weight. Those are signs that diabetes is there and is out of control. But you are in denial. Deni-abetes is killing a lot of us, and I don't know how we fix that. But we got to be focused on the important things in life, and we got to understand that even with diabetes, you can live a happy, healthy life, but you got to manage it, okay? It is not a death sentence, but it is a death sentence if you remain in denial about it, okay? Move on to Die-obesity. Die-obesity is basically what it is. It's diabetes related to being overweight in this country. Obesity in this country is considered a BMI of 30 or better. Most people know how to calculate their BMIs. We have smartphones that do it. We have smart watches that do it. And there are a lot of scales out there nowadays that even do it for you. And if not, there's a calculator online. If you Google it, BMI, put in your height and weight, it's going to tell you what your BMI is. A lot of us don't need to do that to know we overweight. But if you're concerned and you want to know for sure, put that in. If your BMI is 30 or better, you're considered obese in this country, and you are at high risk for die-obesity. But die-obesity is running rampant in America. A lot of it has to do with our diet, our lifestyle, and our lack of exercise. We got to get moving, y'all. Exercise is the best preventive medication of any condition out there, especially including diabetes or die-obesity or Deni-abetes. Okay? So if you want to be proactive, you're a big fan of not taking medicines. I hear patients all the time, yeah, I'm 50 years old, I ain't never took medicine. But yeah, you got heart failure now. You have ED. You lost a leg. Is that something to be proud of? No, I don't think so. Give me the medicine if it's going to keep that from happening, and tell me what else I need to do so I can stay on this side of the dirt. But yeah, die-obesity is big, y'all, and it's literally big. So be careful with that. And the final one is die-abetes. And sometimes I think they were being funny when they diagnosed diabetes what it is, but I don't think they knew back then when we diagnosed it as Dia-abetes, D-I-A, that it would end up being Die-abetes, D-I-E, because that's what it is. Diabetes is the #1 stunner out there in the streets, killing more folks than anything. It's the reported seventh leading cause of death in America, but we believe that is very underreported, and it even said that in the report that diabetes is underreported as a related cause to deaths in America. Because, you know, sometimes we can't always directly connect the dots that diabetes was a component of the patient's demise or their death. But a lot of times, most of those patients that died prematurely or had other conditions that were advanced way beyond what we would expect them to be based on what we know medically, diabetes was the one to expedite that demise. So diabetes is a risk factor for premature death. And if you don't do anything about it, y'all, it will come knocking and it will take your life prematurely. And I'm encouraging all the men out there and the ladies that follow, know your numbers, know your risk factors, be proactive, don't be in denial about it. And if there's some medicine that can help you, and you got a provider that you trust and confide in, go see them, make some changes. You know, be here for your family, be here for your kids. I want to live a happy, healthy life all the way until the end. And if that means I got to do some stuff when it comes to medicine along the way to prolong this life and have good quality of life and some longevity, hey, sign me up. But your boy Priority Male LLC, I am focused on men's health here in America because, again, we all know men don't take good care of themselves, and I've been doing this for 22 years. For the last 11, I've been a nurse practitioner, and I've seen men's health decline over the years, and it's not getting any better. And ladies, I feel you. I know you're tired of nagging us. I know you're tired of nagging us and dragging us to the doctor. Your boy Priority Male is about to roll out some services that will hopefully meet the needs that you have for your loved one, your helpmate, your husband, your boyfriend, your dad, your uncle, whatever male role model or male figure in your life that you love and you want to be here and they're in denial, you're going to be able to send them my way in just a minute. So stay tuned, y'all. Priority Male LLC will be coming soon to you. I'm going to meet you where you are, man. There ain't going to be no excuse. I want to make it accessible. I want to make it convenient. And I'm going to hold you accountable because guess what? Your boys and I got the same problems you got. I'm living in this world just like you. I have the same desires and needs you have. So I truly understand where you're coming from, and I'm going to shoot it to you straight. And I can help you get on the path of wellness because that's where it is. And always remember, y'all, Priority Male LLC is coming to you soon. But the thing about Priority Male that I've been promoting for a long time is easier to stay well than it is to get well. #Priority Male. Y'all stay tuned. Thanks for your time, y'all. Peace.